All right, welcome Olivers. Welcome to Olive Live Learn Thrive on Wednesdays. Usually we are focusing on mental health in the month of April. And we have a guest speaker here today with us. We have Dr. Ayesha Mian. I would like to introduce her to you all. She is a psychiatrist specializing in addiction medicine and practices in Northern Virginia, treating people with mental illness and substance abuse issues in the community. She's also an assistant clinical professor of psychiatry at George Washington University School of Medicine. Ayesha is an advocate for health and human rights, especially as it relates to the mentally ill and survivors of trauma. Ayesha has served communities in remote villages in Pakistan, disaster-stricken and war-torn regions, including Kashmir, Haiti, Syrian refugees in Jordan, asylum seekers from Afghanistan, as well as the persecuted Uyghur population of China. She is a strong proponent of mental wellness through holistic measures, including natural and preventative methods to avoid pathological patterns of health. She volunteers as a Physicians for Human Rights Asylum Network provider and at the Arlington Food Assistance Center. She is a fellow of the American Psychiatrists Association, diplomate of the American Board of Preventive Medicine and American Board of Psychiatry and Neurology, and Aspen Ideas Health Scholar. In her spare time, Ayesha loves to run, row, and read. She is currently learning Arabic and how to play the guitar. Welcome, Dr. Ayesha. So nice to have you with us today.
Thank you so much for inviting me to speak, Zainab. I'm so honored to be a part of this conversation, and hopefully this can be a conversation and not just me speaking. I'm really happy to be supporting Olive members, and we can get started. I'm gonna only speak for about 20 minutes because it's Ramadan, and I know we're not all great with our focus during Ramadan, so I'll leave a lot of time at the end for Q&A. So you're welcome to either write your questions in the comment section, or we can just talk about it at the end when I'm done. So I won't be able to control the PowerPoint, right?
Yes, give me 1 second. I'm sharing it right now. All right, Olivers, can everyone see the screen? I'm guessing, yes. All right.
So as I was thinking about, what might be a good topic to talk about, I thought probably depression and anxiety and how to recognize the signs and symptoms is probably going to be the most relevant topic in this day and age. It's important to be able to recognize the symptoms of depression and anxiety in ourselves, but also amongst people that we care about, our family members, our friends, because a lot of times people are not very aware, and they don't really know what it looks like. And it's important to get the help that you need if it does get to the point where you are suffering from depression or anxiety. So I'll talk a little bit about why it matters, and then go into just a little bit of detail of the symptoms of depression, anxiety, and then just talk about a couple of cases just to make it a little more interesting, and basically medical cases that I would normally see in my practice. Okay, so why it matters. So depression amongst adults in the US pre-pandemic was always around the rate, like for a number of years, was around 8 to 9% for depression, and anxiety a little bit more than depression, but generally around 8% of the people in the US suffer from depression. But since the pandemic started, the rates of depression have gone up 3 times. So jumped from like 8 to 9 to around 27, 28%. And that survey was done last year around March and April. And since then, so for the last year, the rates have even gone up further to around 33%, which really means that 1 in 3 people in America are suffering from depression and anxiety. So it's a staggering number, which affects so many people. And I'm sure you also know people, personally, that are people that you might live with that do suffer from depression. And during the pandemic, we've seen, I think you probably already know, that a lot of the pandemic affected people in the lower income in the lower income category, and also people who are immigrants, or the immigrant population, and people who are just underserved and don't have a lot of resources. And we see that the pandemic affected that, but also the depression and anxiety rates have gone up higher in those populations, more so than the other groups in the US. So that's why it's important to just be aware and to recognize what it looks like. Can we go to the next slide? So I'm going to just present 2 cases. These are cases that have that are very similar to what I would normally see in my practice. So a 65-year-old man with a history of just blood pressure issues comes to his primary care physician's office for a regular checkup. He is only aware of his problems with sleep, but the doctor notes that he has lost 20 pounds in the last 6 months since his last visit. He says that he's not sleeping as well. He sleeps only about 2 hours a night. 2 hours at a stretch, and then wakes up. It takes him a while to get back to sleep again. And then he gets another couple of hours. So he sleeps in total 8 hours, but he doesn't feel rested, feels very lethargic and fatigued. He cannot really maintain any level of activity during the day. When the doctor asks him more questions about about his social history, he says his wife passed away. His wife for 40 years passed away 2 years prior to that. And he doesn't have a lot of social supports. His kids don't live close to him, and he doesn't see the family and friends that he used to see when his wife was living. So he lives a very isolated life. And he himself actually doesn't recognize any of the way he's feeling or the symptoms he's having are of concern. And we see that a lot in men who, especially older men. They don't recognize that depression can look a certain way, it's also hard to get them to treatment. So, and we'll talk more in detail about what else you look for when someone is depressed. Oh, next slide, please. So the next case is a 55-year-old woman with hypertension, diabetes, cholesterol issues, who goes to her primary care with complaints of abdominal pain, GI symptoms, chest tightness, insomnia, lack of proper sleep, sweaty hands and feet. And she has been isolating a lot because when she's around people, she gets she feels nervous and panicky, and she gets very irritable and agitated. She's unable to get tasks done at work, and she's just started to isolate because she feels she's better being alone than being around people. She's had these symptoms prior in her life when she was younger, but now they're happening regularly, once a week or more. And she does not understand what is going on, what the symptoms are, and her family and friends also don't really, they can't really support her because they don't know how to help her. Next slide. So the first case is basically a very classic case of depression. You see people have poor sleep. They can't sleep. They either sleep too much or they sleep too little. Their appetite is poor, so they either actually are overeating or they don't eat at all. So there's either weight loss or weight gain. They feel lethargic, there's low energy. It's either related to the sleep or their appetite or just feeling fatigued. Poor focus and concentration. They don't like to do the activities that they normally would do if they were not depressed. They have feelings of hopelessness, helplessness, feelings of guilt that is unplaced. They also can get physically agitated, or they could be physically just slowed down. It can also progress to the point where they start to have thoughts of hurting themselves, or having feelings that, you know, life is not worth living. They might say that, you know, they won't do anything actively to harm themselves, but they have thoughts that just there's nothing to live for in life. Next slide. Next slide. Sorry. So as a doctor, when a patient comes to me, we refer to what's called the DSM, the Diagnostic Statistical Manual, which kind of has the criteria for every single psychiatric diagnosis there is. So when someone comes to me, I would ask them all those questions about, you know, their sleep, appetite, energy, focus, you know, thoughts of hopelessness, helplessness, thoughts of suicide and stuff. And then you kind of see whether they meet criteria to be diagnosed with depression or not. And you have to have these symptoms for at least 2 weeks. A lot of times people don't even come to treatment until like months of feeling a certain way. But you only need like 2 weeks of these symptoms, and like 5 of the several symptoms that can happen to be diagnosed with depression. And depending on the severity, we decide whether someone needs medication or just therapy alone can help. And you know, what kind of supports they have, that also determines you know, what treatment we prescribe for the patient. And on top of that, I mean, I'm basically only talking about depression, but there are other things that we screen the patients for. So like, you know, we make sure that there's no drug use, there's no alcohol abuse, because those themselves can cause depression and anxiety too. We also make sure that there's no medical issue that's causing their symptoms. So if someone is elderly, we want to first of all make sure their labs are okay, their thyroid is normal, they don't have other, you know, chronic pain issues, other major medical issues that they have that are being addressed, because medical issues can also mimic depressive symptoms. And then also let's screen them for mania or bipolar or other psychotic symptoms. Next slide. So the second case that I talked about was a woman who was anxious. We see anxiety it tends to be more common in women. You see, you know, people with fear, with like these feelings of fear all the time, or it can also progress to a panic feeling, feeling like something bad is going to happen, like there's feelings of impending doom. The anxiety is usually so much that it physically manifests itself too. So they'll have like high heart rate, shortness of breath, sweaty hands and feet, numbness and tingling, and GI symptoms, which are very common in anxiety. So like stomach aches, diarrhea, and just like, you know, physically just feeling tense. And a lot of times people that have anxiety, they don't even go to a psychiatrist. They are usually like present themselves to their primary care physicians. It's not something, and it's so common. It's so common that it ends up just being treated with medications, with PCP. But actually, there are a lot of things that we can all do to prevent the depression and anxiety to happen or occur before it gets to the point where you're actually diagnosed with it. Can you go to the next slide? And one of the most important things that can happen, especially for anxiety, that you can do to prevent it is exercising and doing cardio. So 30 to 40 minutes of cardio a day, most days of the week. Studies show helps with depression, mild depression, symptoms of depression, just as much as therapy does. So if you can add a cardio regimen to your routine every day, just keeping your heart rate up 30 to 40 minutes a day, that can prevent a lot of issues with anxiety and depression also. Having a healthy diet that's high in antioxidants, that's an anti-inflammatory diet, not a lot of sugar and carbs, and more focused on like white meat like fish and high omega-3 fatty acid meals, that helps with mood also. Getting a lot of sun helps too. I was just thinking about that because it's 80 degrees here in Virginia, and it's such a huge change when you go from like 40 degrees to 80 degrees. Being outdoors and being out in the sun helps with vitamin D levels also. So making sure a diet is your diet or your supplements that you take have a vitamin D supplement if you're low in that. Breathing exercises and meditation, which is generally, if you've had problems with anxiety, I'm sure someone has told you that, just slowing down and taking deep, long breaths, like taking a long inhale for several seconds, and then holding your breath for several seconds, and then exhaling over several seconds, slows down your heart rate, slows down your breathing rate, slows down your pulse, your blood pressure, and you repeat that cycle multiple times. You could do that several minutes in the morning, in the afternoon, and at night to calm yourself down. And also it promotes sleep if you do it at nighttime. Practice of mindfulness, which is generally just like being present and trying to be in the moment and not worrying about the future or the past, and trying to bring your thoughts back to where you are, like to the present moment, also is helpful. And there's mindfulness practices that there are studies that show that people who practice mindfulness, it actually changes your brain and makes it healthier, makes it more robust to the parts of the brain that are involved with mood are more robust, meaning they produce the normal the neurotransmitters or the chemicals in the brain that are involved with mood at a better rate or a better rate. And then having a structure and routine to your day is very helpful. Knowing that you're gonna having a routine that every day you're gonna wake up and do something, whether it's a walk in the morning or, calling a friend or, making breakfast or whatever. This just having the same routine actually helps with mood. And then obviously, as human beings, we're social creatures. We're supposed to rely on each other. We're supposed to rely on our family members and our friends, and having those having like more positive and strong relationships helps with keeping a sane and a healthy brain and mind also. Next. Wanted to talk a little bit about resilience. So resilience is the ability of human beings to continue to charge forward or move forward in the face of adversity. There are people that you might know that have been tested or have had a lot happen to them in their lives, and they just keep moving on. And there are other people who are not able to handle that stress. So what is the difference? You know, how do you become more resilient? There are actually ways that are studied that can make people more resilient. And if you add those, if you do those things to help yourself, those things will help you become more resilient. And there are three main things that I think are the most helpful. One is social connections. So making sure you have very healthy, positive, and loving, caring, good relationships in your life, and relationships that you can rely on, where you can depend on someone and someone else can depend on you as well. So basically investing in your relationships is one key factor. Another one is having hope and, you know, just the power of positive thinking. And the concept of, you know, whatever adversity you're facing, it's going to get better. It will pass, because everything changes and everything passes. So if you have that, if you think of it in that way, that helps. And then the third main concept is self-care, which could be different for different people, but in general, that includes something you do for your brain, your body, your you know, eating well, exercising, meditation, you're working on your spiritual health. If you're religious, prayer helps. So all those aspects can help build resilience. And just one other thing I wanted to mention before I open it up for the Q&A. There was a study that was done at Yale and Mount Sinai on former prisoners of war and special forces military personnel and patients that had very severe, chronic, debilitating medical issues, and to see, you know, how they were resilient under such extreme, prolonged stresses. And they saw that there were a few factors or few characteristics between these people that were common. So most of these people had some positive role models in their life, whether it is their parents, a friend, a mentor. They all had someone that they could look up to, or had a good, you know, they could basically rely on, and that have helped them in their life. Optimism, which is self-explanatory, just positive thinking. Humor, which is basically a very mature or mature self coping mechanism, which you know, if you employ that helps calm down a lot of the negative feelings and negative emotions like fear, anger, and shame. If you have a moral compass in life and you live your life with a code of ethic, or a moral code, that helps. They also saw that those people had, their personalities were selfless, like they would do things for other people, and that would give them, that would actually make them feel better. A lot of these people had belief in a higher power, so they were religious or they're spiritual. They had social support. They knew their personal strengths. They had purpose and they found meaning in their lives. And that purpose could be different for different people. And that they were flexible in the way they thought about things. So it wasn't like a black and white way of thinking in their, for them. They were very, you know, adaptable. So anyway, we can look at that population. We can look at that population and, you know, and try to see what helped them, or what characteristics they had that helped them, and use that as a guide for ourselves too. So I think that's the end of my talk. I can open it up for questions now. Zainab, we can take off the PowerPoint if you'd like.
Thank you so much, Dr. Ayesha. That was really, I think that was just the perfect amount of information and, tools for us to kind of recognize, at the same time prevent, and, treat it in our own small ways. I've also heard
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.